Good morning, everybody. My name is Kristin Rotblatt. I'm an acupuncturist and an expert in cellular healing, and also one of the things that I specialize is in thyroid challenges, hypothyroid, hyperthyroid, Hashimoto's disease, which is an autoimmune condition of the thyroid. And I want to talk today a little bit about the kinds of labs that you actually need to make sure that you are really looking at the full spectrum of what is happening with your thyroid on paper, on a lab. I've had a lot of people come to my office over the years and they say, well, you know what? I have all the symptoms of having problems with my thyroid. My hair is falling out. I can't stop gaining weight. I'm constipated. My skin is dry. I have, all kinds of problems getting pregnant, etc., etc., etc. And yet, when I ask them what is happening in regards to the thyroid, they say, oh, no. My thyroid is normal because my blood tests come out normal. First of all, here's what I want to say about your blood tests in regards to your thyroid. Blood tests are not the perfect definitive answer. And that is because when you get the blood test on that day, that is what is happening with your thyroid. You get it a week later, you can have a different blood test. You get it a week later after that, you can have a new blood test. So the thyroid and the functions are constantly changing. So are the markers. So I want to make sure that everybody knows that just having a test that only has TSH or thyroid stimulating hormone is definitely not enough. That doesn't reflect what is happening in your thyroid. I know that the doctors think that it is a gold standard, but there is no clinical studies that say that TSH alone is the gold standard, the definitive answer of what is happening with your thyroid. And I want to say that when people come in, what happens is that I take a look at their markers in a much narrower range. So I'm not looking at the 0.45 to 4.50. I'm looking at 1.8 to 3.0. That's going to give me a better idea about what is happening with your thyroid. Are you hypo or underactive thyroid, or are you hyper overactive thyroid? Also, I know that some people have TSH done by their doc and maybe free T3 or free T4. Again, it's not enough. I do want to look at your free T3, and that is your active thyroid hormone. That is what tells me what is getting into your thyroid hormone receptors on the outside of your cell. Very important marker. Free T4 is a very important marker, but I need to see free T4 in relationship to reverse T3. And that is a marker that most endocrinologists, most doctors forget to do. It's very important to do reverse T3. Reverse T3 is created, and it kind of acts like a little bit of a baseball cap on top of your thyroid receptor, hormone receptor, and it does not allow your active thyroid hormone, free T3, to get in properly. That is because when reverse T3 is made, it is made under a lot of stress, either physical stress, emotional stress, etc. So it's very important to do a ratio between free T3 and reverse T3. And I do that with every single one of my patients. In fact, I've had a couple people that they look pretty darn good on paper, except when I do that ratio. And then, of course, I don't want people to forget the thyroid antibodies. That is a very, very important. Those are very important markers because I want to find out what is happening if your body is overreacting, if you have an autoimmune condition called Hashimoto's disease. And if you do, there are very specific things that you need to do in order to start to allow your body to heal and get better. Very important dietary changes. For instance, if you have Hashimoto's disease, you should never be eating any gluten grains. Very, very important. Not sure that every endocrinologist may point that out to you. Also, Traditionally, thyroid medications haven't been all that much of a support to people with Hashimoto's. I'm not suggesting that you go off your thyroid medications. No, not at all. But what I'm saying is there are other things to consider. Why do you have that autoimmune disease in the first place? What is driving inflammation? You've got to take a look at so many different things in order to get a complete picture. Now, I'm not exactly sure whether every one of your doctors is willing to do a complete thyroid panel. The thyroid panel that I do for every one of my patients costs $88.50. And then, of course, you come to see me and we do an initial appointment, and then I review your test results, and then we get to work. What I want to offer every single person who walks into my office is a partnership. I want a partnership. I'm not a dictator. I'm not like, you do this or you can't work with me. But I want to partner with you. I want to find out the root causes of your disease. And one of the big helps is that if you have problems with your thyroid, that you have a complete thyroid panel, and then we can get to work. If you have any questions, if you want to contact me and my office, please feel free to do so. Contact Lotus East West Medical Center. I'm in Santa Monica, California, 310-828-8258. Once again, the phone number is 310-828-8258. And if you'd just like to have a 15-minute consult where I talk to people, I do that for free. I'm happy to talk to you about what's going on, what is happening with your labs, and then we can go from there. So I really hope this is helpful, and we'll talk to you soon. Bye-bye.